It's my feel-good breakfast show.
Very good morning. Thank you for tuning in. Time to turn to medical matters. This conversation's got balls in it. We are 3 weeks into Movember. Every year, the month is used to raise awareness around men's health issues, absolutely vital, particularly talking about testicular and prostate cancer, as well as the very high rate of suicide amongst men. 3/4 of all suicides are male in this country. We are joined this morning by our resident expert and Dr. Darren Green.
Good morning.
And you are an expert, not only because you're a doctor, but because you're a man, my friend.
Thank you. Thank you.
And the whole point is, I don't mean to make light of it or joke about something that is very serious, but the main point here is to destigmatize this conversation so more men will go and get their prostate checked and will make sure that they are in a healthy order. We're going to see a lot of these photos of the midsection this morning, so we apologize for that. Let's start with the big one, testicular cancer. What age, and I ask this very much from a personal perspective, what age are we most at risk of getting testicular cancer?
The highest incidence is between 15 and 39. So that is a cancer of young men, particularly. So if you think about it, you know, it's extremely sad that it's a very treatable cancer. 95% of those cancers are curative if picked up. So 1 in 20 people obviously will die because they just didn't bother checking. And it's a young man's cancer. And the reason why we miss it, obviously, is because of how it presents. And it presents often very late with symptoms of it having spread already, and that's the problem.
So what are the early signs? First of all, just what kinds of testicular cancer exist within that?
Yeah, the most common type is what we call the germ cell cancer, and that just describes the cell type where the cancer originates from. Okay. So 2 big groups would be germ cell and non-germ cell, and the germ cell is the more common one, accounting for most of the cases. So what happens is it often presents with a painless mass. So a tumor grows on the testy itself, either in the capsule, and you can see whether it's growing on the outside of the testicle or from the inside, then moving out, basically. And what you don't realize is because it's painless, you don't know it's growing. So unless you know what a normal nut feels like,
and to be quite honest, I mean, a lot of men don't know their own physiology to a medical degree to know what is normal and what isn't.
And that's it. So, you know, that's why we encourage so much the normal examination, which is supposed to be a monthly examination, as in women when they examine their breasts.
Exactly, man.
That's the thing.
Okay, so now we are testing, we discover something like that. What is the next step? Should we be getting tested by a doctor as well on a regular basis? What's the next phase on from self-examination?
Yeah, so often the pickup is either by the patient themselves or the doctor or the partner of the patient. Then obviously you'll have it examined more closely, and that would include something like a sonar, which actually looks at the structure. So if you have a mass or an increased mass on top of the normal size testicle, one would then look at that mass, seeing is it a solid thing, is it a cystic thing? In other words, is it hollow and filled with fluid or not? And based on that picture, one then moves forward with more rigorous testing and even biopsy if necessary by the specialist urologist.
We'd love to hear from you guys. If you've got any questions, please give us a shout. 021 430 881. We'd love as many men as possible, but anyone, please, to join the conversation this morning. It is so important that we start talking about this, not just during the month of Movember, which is a wonderful opportunity, but all year round. We want healthy men, healthy inside, healthy in the mind, and healthy on the outside. Doc, thank you so much. We're going to be continuing this chat. We're going to talk about prostate cancer as well and how we can get that checked. I think I'm of an age now where I need to start thinking about that, but amazing to me. Testicular cancer, it's a young man's cancer. Start your testing now.
It's my feel-good breakfast show.
All right, so now, I mean, we've loved this conversation this morning. I don't know if it's just because I'm approaching 40 and that's kind of an important conversation to have, but we now know that testicular cancer is a young man's cancer, so don't wait. Examine yourself. Make sure that you get regular monthly examinations. Now we move on to, I think, the one that we dread because of the stigma attached to it, prostate cancer. Do we still need to go for the dreaded finger exam? You can think about that as we take a call now. Thank you so much for joining us. Anonymous on the line, a very good morning.
Morning, sir.
Good morning. Thank you so much for weighing in on the conversation. What's your comment or your question for the doc?
I'm 52 years old. I've been very sexually active, but I've been diagnosed with high blood and a enlarged heart. Will that affect me sexually, and what can I do?
Great, to the point, yeah.
They said he's got hypertension and
High blood pressure and an enlarged heart.
yes.
And is very sexually active. Will there be a link and can one affect the other?
So depending on which heart condition he's got, you get things called dilated cardiomyopathy. Afrikaans people call it the groot pap hart. One of the big causes of that are alcohol as well. They cause your heart to dilate. You also get a thickened wall of the heart, a ventricle specifically on the left side, that can increase due to hypertension, which he has got. Does that affect your performance? Yes, it certainly can. It can affect your fitness levels and all that if you're not obviously being active and your lifestyle isn't doing anything to change the ability of those symptoms. The cardiovascular system, heart and blood vessels, is affected directly by uncontrolled blood pressure and the amount of physical activity you actually perform. So that needs to be quantified in his case as to how medication can help and how lifestyle can help and what effect that will have on his performance.
It doesn't work the other way. If he is very sexually active, can that have any kind of effect on your health, on your cardiovascular, those sorts of things? Does it work
Of course. Well, I mean, depending on the type of sexual activity, obviously there's a lot of physical exercise for some people, for others less so. But certainly, yes, it can. It affects, it raises your basal heart rate. There's a release of endorphins involved with sexual activity. There are many health benefits to having a healthy sex life.
So, Anonymous, I think you need to look at the factors that are contributing to that, the heart condition. But I think when heart is involved to that degree, if you've been diagnosed, as you say, with an enlarged heart, you need to make sure that you are seeing a specialist.
Correct.
And that you're getting to the root causes. Thank you so much, though. Very, very interesting question. Stay healthy, Anonymous. Stay healthy. So, I asked you the big question. The dreaded finger exam, I ask with dread. Do we still have to go through that process?
Yeah, well, I think it's still a very useful test. Is it the only test? No, it certainly isn't. We often use the blood test, which reflects the prostate-specific antigen, the PSA, which gives you an indication as to basically that specific antigen's level in the blood. And often the pre-runner of prostate cancer can be, in some cases, a benign prostate hyperplasia. That just means an enlarged prostate. Not all people with an enlarged prostate are going to develop cancer, and not all of them obviously are symptomatic. It only becomes symptomatic to a certain point. If you think about the prostate being wrapped around a pipe going through it, which is the urethra, you can imagine as it enlarges and compresses that pipe, you have then obstructive symptoms, which we call the LUTs, the lower urinary tract symptoms. And people need to be aware of those symptoms to know when to seek help.
Indicator.
Yeah.
And to be quite honest, when weighed up against what going through prostate cancer is like compared to the finger exam, it really is worth it. So if you're of that age, of my age, you got to go and do it. So we're going to continue this conversation. 021-430-9881. We'd love to hear from you. We're going to talk about suicide, men's mental health after the break.
It's my feel good breakfast show.
Very good morning. Thank you so much for joining our conversation this morning. We are talking about men's health issues or opportunities with our Dr. Darren Green, who happens to be a man as well. So he is well versed in this. I love the fact that you have chosen to be a very proud advocate of men's health over this time. Just very quickly, before we broach depression, which is massive in South Africa, and males a big component of that, prostate cancer, what are the early signs?
Yeah, LUTs, lower urinary tract symptoms. So that would be poor stream. You don't shoot where you used to shoot.
Okay.
And you have dribbling afterwards, so you can't cut off quickly. You have urgency, the feeling that you want to go, and there's a massive amount of urine on a pass, and then when you get there, there's hardly anything.
Nothing happens.
And then frequency, you just end up going a lot more frequently.
Okay, simple as that, guys. And this is an area of your life that you really should know a lot about, okay? Let's move on to men's health. I think some of the statistics, you know that cancer is a massive scourge when it comes to men and men's health, but suicide is something that we often overlook or don't talk about because men are strong, because we are tough. I've dealt with depression at stages of my life. Some of it situational, some of it just because I have that chemical makeup in my brain. So I've been forced to deal with it, and I'm so fortunate that I have. A lot of men out there haven't gotten to that point. Talk me through suicide, when it gets to that point that you actually throw in the towel.
That's the point where you have no ability to take off the dark sunglasses of depression. In other words, everything you look at and view...
And it is overwhelming, man.
...is viewed through black sunglasses. You actually get irritated by people that are happy and are laughing, irritated by cheerful, happy things in life. That's when you know. And when you isolate yourself, obviously, make yourself an island, you think that's going to help you. but you're actually obviously making it worse. So we want to promote men, obviously, decreasing the suicide rate by actually speaking about their feelings, telling someone. If the problems are at home in your family and so forth, you need to tell somebody else
Find
about
a neutral.
them, you know?
Find someone who is not connected to
And
your
the
life in that
helplines.
way,
I mean,
man.
the SADAC group, the South African Depression Anxiety Group, always good.
brilliant, man.
They have a suicide line, actually, that it's also worth looking at calling when you don't have someone to call and you don't have anyone to speak to. And that's what we need to promote.
So funny you mentioned that. It hit me during the 2010 World Cup, dude. I was
Really?
standing in a fan park surrounded by tens of thousands of people wondering why is everyone else so happy and excited and I'm all alone and I'm surrounded by my family and best mates. And what worked for me, it's not for everyone, but getting back into an exercise routine, getting back into martial arts, finding something that was just for me, that did help
positive.
to inspire me. But it started with talking to someone.
And changing your focus from your negative impacting circumstances, directing your attention and focus into something that evolves and becomes something better, like, for example, exercising, like a new hobby, like, for example, applying yourself to actually even starting a new skill.
And the bottom line is the life lesson that I learned is it doesn't make you weaker talking to someone. It actually shows true strength. You are a real
Character,
man
yeah.
when you can man up and actually talk to someone. If you would like to talk to us right now, we'd love to hear from you. We are talking all men's health issues as part of Movember. 021 430 9881.
It's my feel good breakfast show.
So we continue to talk about men's health issues. Just very quickly, a brilliant call came through in the break. I don't know if we've got her back on the line now, but essentially she was saying that prostate cancer has emerged with 3 men within her family.
Correct.
And she's wondering then if her nephews are at greater risk. Is there a genealogy link?
Most definitely, both in prostate cancer and in testicular cancer, specifically if you've had a brother, father, grandfather as well.
Wow,
One
okay.
must take that into consideration and even be more rigorous in testing and screening.
And hopefully then that means the family is educated around that as well. But the key thing is just test regularly. Test as often as you can,
Correct.
at least once a month. Testosterone. We know that it is always going to be leaving your body the older you get. How does this tie into our overall health as men, and how quickly do we lose it?
Yeah, so I think from the age of 29 already you start dropping your testosterone levels. You've lost half of it by the time you reach 40.
Wow.
So it's quite interesting. So, well, you know, so that curve differs for different people. But understanding that a reality is when you have too little testosterone, there are systemic manifestations that people weren't aware of before, like your muscle mass you struggle to retain. You also struggle with low energy. Your mood can become low.
Sexual activity.
Your drive, your libido also becomes tarnished as you get older as well. And women also have testosterone, by the way. They just have it in less quantities than men do.
Can you get, as we would look at hormone replacement therapy, can you administer testosterone?
Yes, so there are different forms of treating a testosterone deficiency syndrome. They are injectable forms, some of them just a simple injection under the skin or into the muscle. And then, of course, we have even applied creams that contain testosterone now that people are using, which make it obviously a lot less invasive.
One last thought. We've got about 20 seconds. What's the most important message for you to drive in this Men's Health Month of November?
I think we need to really educate ourselves regarding the role as parents. I think leading by example as a parent in your household, as a man, in terms of taking ownership of your health is key. Role models, our kids are looking for role models elsewhere because we aren't stepping up to the plate and being role models as men in our communities and in our homes, and we need to start doing that. Take ownership, show that you actually care about it, get moving. Part of the Movember campaign involves movement, not just testicular prostate cancer and preventing depression and talking about it, but also moving, because those reduce your risk of contracting those cancers.
It's all one system, and I would just add to that, if you are feeling like you are alone in the world, you are not, go and speak to someone, please. Dr. Darren Green, love you, bro.
Pleasure.
Absolutely
Thank you.
love you.